your very own saliva, your very own saliva can irritate your skin like this, my medical fans? This boy that I know who loved licking his lips frequently developed this ugly looking mouth. During the dry harmattan season in Nigeria last year, all the family members were perplexed because, what is this? You may ask. In fact, his mother had always made sure he had lip balm in his school bag because due to his frequent lip licking, his lips were always dry and scaly and just downright embarrassing. Because she had to explain to the teachers and friends and everybody they encountered why her son's mouth looked like this. Because, hey, everybody would be horrified to see their son or their daughter having a mouth like this, right? And so, this young boy's mother had no choice but to visit the pediatrician. And voila! The pediatrician diagnosed her son with this strange condition called, believe it or not, lip lickers dermatitis. Wow! Is that a real disease? It is. In fact, lip lickers dermatitis goes by so many names, like lip eczema, eczematous cheilitis, irritant contact dermatitis, because yes, the skin around the mouth is in contact with an irritating substance. Hey, in this case, the irritating substance is your own saliva from your own tongue. How about the name lip cheilitis? Yes, that's another name for it. Some people even call it lip lick cheilitis. Some call it a longer name, irritant contact cheilitis, due to lip licking. Lip licking eczema. How about saliva-induced contact dermatitis? Yeah, you can see there's so many names for this condition, which is commonly, as I said before, called lip lickers dermatitis. So, my medical fans, what was really happening to this young boy's mouth? Because you can see here that, yeah, this irritation was less in these pictures that I'm showing you, right? So, we know that this lip lickers dermatitis is commonly seen in, school-aged children, just like this boy. I mean, this boy was just 6 years old when he developed this condition. I mean, but it may occur in at any age. In some patients, I mean, you commonly see that they have difficulty in controlling their impulse to lick their mouth. And in some other patients, you find out that they have some cognitive impairments, difficulty in reasoning and thinking abilities. And so they tend to have this compulsive lip licking. I mean, this boy actually complained of burning and dryness around the area where he was constantly licking. And of course, yeah, you would have that, isn't it? I mean, see, my medical fans, even though this lip licking habit might seem like, oh yeah, there's no big deal if my son licks his mouth. You may think that it's just a benign habit, right? But look, this lip licking can have serious complications. Yeah, can have some serious complications. I mean, just look at this mouth. The skin around your mouth might actually break down because of the constant inflammation and irritation taking place around that mouth. And of course, easily bacteria can now enter into your skin, right? And yes, what is the resultant effect? Infection, of course. Infections, bacterial infections, even yeast infections, fungal infections. And yes, you can have this chronic darkening around your mouth, which luckily for this boy, well, it was short-lived after he was treated for lip lickers dermatitis. So, I mean, when does it occur? Yeah, I mean, this condition, lip lickers dermatitis, it occurs commonly when, you have dry or cracked or chapped skin, on your lips. And it commonly occurs, as I mentioned before, during, the winter season, during the Harmattan season, just like in this boy. It was during the Harmattan season, and he kept on licking his chapped, dry lips. And although, yes, we all know that, okay, if you keep on licking your lips, you may have some relief, right, from that dryness. But the thing is, the saliva actually keeps on drying out your lips more. Yep, that's the effect of saliva. Believe it or not, my medical fans. So it's like the saliva, keeps on worsening the situation. And there's this cycle of, dry, wet, dry, wet, dry, wet. And eventually, yep, the lip lickers dermatitis develops. So you have this dryness of the lips, you have dryness around the mouth where your tongue is constantly going round and round and round, isn't it? And, in lighter skinned individuals, the skin will become reddish, isn't it? But of course, in black skin, like in this young boy, it becomes discolored. It becomes, sort of like brownish, darkish, hyperpigmented, just like in this young boy. And of course, the lips are even more chapped. They're even more dry. And then there's scaling. You can see this scaling. Can you see it? There's this scaling. Can you see that around the mouth? There's scaling, and you have peeling, yeah, in a ring-shaped manner around the mouth. You can see it. You can see that it's even extending to this cheek because the tongue is just extending and extending, going round and round, chopping up the skin, the saliva chopping up the skin, so to speak. And so you see all sorts of things, peeling of the skin. You can see some areas are actually peeling. You can see the dryness. You can see the crusting. You can see some crusts, right? Yeah, like some deposits around the lips. So even though you have these symptoms, these signs that are close to the lip area, you can see that the skin, even beyond, where you can actually think of, is affected. You can see even very close to the nose, right? So as far as this tongue and the saliva can reach, you have this level of inflammation around. You can see that, right? You can see how bad it is. You can see that inflammation taking place around these lips. So this area of inflammation, as you can see, it is crossing the vermilion border of the lips. What is the vermilion border of the lips? This area. Can you see where I'm outlining? This area, the vermilion border, that, interface in between, the wet and the dry area. Okay? So commonly, you find out that what happens is saliva actually is eating your skin. Can you imagine that? Saliva eating my skin? Yeah. It's almost like saliva is eating up the skin around your mouth. Because this repeated skin contact with saliva that has digestive enzymes. Did you know that saliva has digestive enzymes that can harm the delicate skin around your lips? So when you lick your lips, these digestive enzymes, just like the enzymes that actually chop up your food in your stomach, they're called, some of them are called amylase and maltase. Now, these enzymes that are also contained Enzymes are contained in your digestive juices in your stomach, and those are the things that help break up your food, right? But in this case, these enzymes are actually breaking up your skin. Yeah, they're breaking up your skin because you're constantly licking your skin. The saliva containing these enzymes constantly keep on wearing down the skin around your lips. And over time, this will leave your lips more vulnerable to the dry air around you. And so, of course, your skin will break open, it can bleed, you know. So, yeah, as I said before, if we lick our lips, of course, saliva adds moisture to the surface of our lips, but only for a brief period. And as the saliva evaporates, the lips will likely end up drier than even, before you began licking them. So, if you just occasionally lick your lips, I mean, that's fine, right? That's fine. However, if you continually persist to lick your lips throughout the day, that will dry up your lips and it will lead to chapping, drying up of the lips, splitting, flaking, peeling of your lips, especially if you live in a cold or dry climate, right? Or if you got in the sun without using a sunscreen, without using some emollients, something, like a lip balm with a sun protective factor that will protect your lips. I mean, hey, my medical fans, we all know that lip licking is a natural response to any irritation on the lips, right? Because, I mean, many people don't realize how often they lick their lips throughout the day. So it can become like a vicious cycle because of these conditions I mentioned before, the harsh, dry conditions, when it's very hot, the sunburn. And of course, as I mentioned before, if the child or the person has any form of, anxiety disorder, some behavioral tendencies, because some people have, these small habits. They develop these small habits to handle feelings like anxiety or, if they're nervous, if they're bored, right? So because, I mean, excessive lip licking might actually be one of these habits. I mean, some people actually have some cognitive impairments, both kids and in adults. So while lip lickers dermatitis is primarily caused by external factors, I mean, some eczemas actually occur because of some genes or some problems in the immune system. Look, these people have a problem in regulating that impulsive behavior like this lip licking. And as I said before, you tend to have this irritation of your skin, this chronic dry skin. And some people that have this common eczema that we commonly see called atopic dermatitis, which is the most common type of eczema, can develop this condition. Some people that have allergies, probably have some coughs, some upper respiratory tract infections, can have nasal congestion. And this nasal congestion actually leads to mouth breathing. So this mouth breathing can actually dry up the lips, right? And some other conditions like lupus or Crohn's disease, and even some drugs like, vitamin A or even diuretics can aggravate this lip licking dermatitis. So, as I said before, yeah, so this protective barrier around your skin is broken, and, this irritation, this lip lickers dermatitis takes place. So, but don't forget that, look, it can resemble other skin conditions around the mouth, right? So you need to see your healthcare provider who can make the adequate diagnosis. Luckily, like in this boy, as you're seeing here, he got the right diagnosis and he got the right treatment, and that is why the lips are looking much better. You can see the irritation is slowly going away. You can see that the darkening is around his lips, but it's slowly going away. And right now, this boy doesn't have this typical appearance because it has been treated completely. Because, I mean, hey, your healthcare provider will want to rule out other conditions, right? Your doctor will want to rule out other conditions which mimic this lip lickers dermatitis. And these conditions are things like perioral dermatitis, allergic contact dermatitis, or sometimes even some precancerous spots or other underlying health conditions can make your lips appear like this. But of course, after they examine the area, they review your health history and ask questions about your symptoms, right? If they get the diagnosis, they'll treat it immediately. If they're not sure, they might decide to refer you to a dermatologist or even a pediatrician, depending on where you go to, right? And so, how do you treat it? How did we treat this boy's lip lickers dermatitis? Well, lip lickers dermatitis, it involves making sure that you alleviate that burning sensation, the irritating, the itching sensation around the lips. And also, of course, addressing this habit of lip licking, which in fact, in the first place, led to this lip licking dermatitis diagnosis. So, your doctor will recommend that you should apply a lip balm containing things like, petroleum jelly, ceramides, shea butter, several times a day, right? And of course, it should have a sun protective factor, at least maybe 15, to shield those your lips from sun damage, especially if they're constantly exposed to sunlight. Of course, don't use a lip balm that has irritating fragrances like menthol, mint, because that might actually make the lip irritation even worse. And make sure that you take plenty of water to stay, hydrated. Protect your lip from harsh weather conditions. Stay indoors. I mean, sometimes you may even have to use a prescribed topical steroid ointment to help with this inflammation. Sometimes your doctor might need to prescribe some mild to moderate strength topical corticosteroids like hydrocortisone ointment, which is what was used for this young boy. Sometimes a topical calcineurin inhibitor like tacrolimus ointment or pimecrolimus cream can be used. But many times just the topical hydrocortisone ointment may actually just resolve the symptoms. Just like in this boy, you can see the lips are looking much, much better, right? If your lips feel really, really itchy, okay, you might use an over-the-counter antihistamine. It could provide relief for you. And if your lips look really, really horrible, you might decide to exfoliate away this dry skin with maybe like a homemade lip scrub using maybe some oatmeal, maybe a little bit of salt. And of course, hey, my medical fans, avoid picking at your dry lips. Please, 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 please. So, how do you break the habit of licking your lips? If you have that habit of licking your lips, especially for our young children, of course, apart from using the lip balm, you can chew gum instead, right? Because that will help you, continue that repetitive movement that you so seek. But of course, you need to reverse all those bad habits, right? So you may need to take your child to a behavioral, therapist so that they can undergo some relaxation exercises, muscle relaxation exercises like, deep breathing exercises. Or they might even need a form of talk therapy and cognitive behavioral therapy. So, my medical fans, please don't forget that this lip lickers dermatitis, right, is different from simply having chapped lips. Because if your lip irritation doesn't heal after like 2 to 3 weeks of doing all of this, you need to check with your healthcare professional. And of course, we all know that, of course, prevention is better than cure. And, make sure that you practice this habit of lip licking. Break the habit of lip licking, and make sure that you are mindful. Prevent yourself from licking. Prevent yourself from becoming nervous. Use distraction techniques like using gum, chewing gum. Use toys. Let the child play with toys to redirect the urge to, for him or her to lick the lips. Alternative behaviors. Engage the child, right? And the child's lips will come back to this way. So make sure that, you get the right diagnosis, make sure that you treat it adequately, as I mentioned before, through all these simple lifestyle changes, of course, after a proper diagnosis from your doctor. Keep your lips moisturized, limit your habit of lip licking, and your lips will become like this. In more severe cases, may require, some stronger prescription strength ointments, or, of course, as I mentioned before, behavioral therapists. But by and large, lip lickers dermatitis is a straightforward condition, and all healthcare professionals need to know about this. All of us laymen and women need to know about it, because it is really, really an interesting diagnosis, right? And this is how it appears in black skin. I hope you enjoyed this. I'll see you again for another live soon on some other interesting medical condition. Love you guys, my medical fans. Bye. If you have any questions, tell me in the comment section and click like. And continue watching more videos from the Medical Information Channel. Bye.